Good morning, everyone. And thank you for coming again down to headquarters, and for those of you watching on the web. Let's see. Oh, there we go. My name is Tony Maida, and I'm an attorney with the Administrative and Civil Remedies Branch and Counsel's Office. And the lawyers in my branch work on all of the different healthcare fraud cases around the country. As part of that, we negotiate corporate integrity agreements, and then we monitor those agreements after the case has been settled and the agreement is in place. As Amanda said, I'm going to walk through and provide you with some tips on having an effective compliance program in your organization. So, Amanda walked through the 7 elements, but once you have a program in place, you're going to need to kick the tires periodically to make sure that it is working and to see if there's anything that needs to be changed or updated. The 7 elements are pretty broad-based, and there certainly are differences between a small physician practice and a large academic medical center, but those elements are useful guidance and can be applied to any type of healthcare organization. So I'm going to walk through each element now and sort of take a little bit of a deeper dive in and give some practical tips on how to measure whether the compliance program you have put in place is effective. The handout titled Operating an Effective Compliance Program has a lot of what I'm going to say, and so you can use that to follow along as well. First, you're going to need to regularly review your policies and procedures, including your code of conduct. In CIAs, we require providers to do this on an annual basis. Ask, are they up to date? Are they understandable to the employees who are going to use them in their job? If the only person who can understand your policy is the lawyer who wrote it, you need to go back and look at it again and make sure that it's understandable to the actual people, the billing clerks, the people who are going to do the coding, so that they know how to do their jobs appropriately. Does the policies include real-life examples of the right way and the wrong way to do something? Put this review on your compliance committee's agenda and involve them in the review. Also involve your department managers and the people in the actual department that the policy applies to in the review as well. This is not something that just needs to be limited to the compliance officer or the people in the compliance department. Next, also with your compliance committee, create a work plan for reviewing your program over the year. This is really sort of where the rubber meets the road on measuring whether your program is effective. You have to come up with a plan. Think about what you want your program to accomplish over the year, what you want to measure. One thing to think about is, what does your board want to know about? For example, you could track the frequency of hotline complaints, the progress and number of internal investigations that are done, the success of corrective action plans that you may have put into place, and how often the same issue comes up during the year. When you don't meet a goal, as part of that plan, you'll need to examine the reasons why and how to improve in the future. Perhaps your compliance program doesn't have enough resources, or those resources may need to be redirected or redistributed in a different way. And it's important to, we understand that healthcare providers everyone has limited resources, but there is a way to think, it is important to think creatively about how those resources should be deployed in the most effective way. Next is train your staff. You should also update your compliance education program each year. It's a good project to include with your policies and procedures update. You need to make sure that your training is current. Lots of things change in the healthcare industry and in the laws every year, and so you want to make sure that your policies and procedures and the training that goes along with them is accurate and up to date. Also, in the training, it's good to have real-life examples of mistakes that people have made, the right way, again, and the wrong way to do something. Also, consider ways to test your employees' knowledge at the end of the training. Try to make the training interactive. One way is to involve staff in creating and actually delivering the training to their peers. This also is not something that is solely limited to the compliance officer or the compliance department. You can involve staff in creating and being the trainers, and people tend to learn, people tend to learn better from their peers. It also creates more buy-in with the training process and gets greater participation in the process. But at the end of the day, training is like exercise in many ways. You can't exercise for 1 hour a year and expect to see results. In the same way, training needs to be a regular part of the job and something that people do on a regular basis. Again, be creative in the training process and how it's formatted. Consider sending department managers compliance updates to use in their regular staff meetings. Include compliance messages on internal newsletters. Create a contest. In one CIA that I monitored, the provider created a Jeopardy-style game in their organization. They split people up into different teams and actually had sort of a question and answer type competition. It's certainly more engaging than perhaps the PowerPoint presentation that I'm giving you right now, or that a lot of training tends to be. But this is a way to, as I said, think creatively about how to incorporate the training into your organization and get people to participate in it. And finally, make sure that training is a job requirement that people are evaluated on. There's the carrot in making the training fun, but there's also the stick in making it part of someone's performance plan, and make sure that it is something that people are evaluated on. And finally, don't forget some training for the compliance officer and your staff. You are here today, or you're watching on the web, so I'm probably preaching to the choir on that point, but it is important to continue your own professional education and development. There are lots of resources out there for in the compliance community, and I think one of the most important things to do is to network with your compliance peers. Go to the conferences, connect with your professional organizations. The compliance community is actually a relatively small one, but it tends to be one, based on my experience with them over the last 6 years, one that likes to share their ideas and share their experiences both with the government as well as with their healthcare provider peers. So there's often a lot of talk about having open lines of communication, but how do you really create open lines of communication between the compliance officer and the employees of an organization? That's a tough question, and it really depends. It really takes a lot of different intangible variables to create those open lines of communication. One thing that is sort of a global theme is to stay visible, for the compliance officer to stay visible and be accessible to the employees of the organization. It helps if they know who you are, and if they have actually met you at some point. They're more likely to then call with a question or engage in the compliance department if it's more than just a box on your org chart. Use newsletters and internal guide websites or news to communicate directly with people, but also show up in person at staff meetings and corporate events and engage with the staff so that you can create that personal connection. One thing, and that's a pretty standard procedure in many compliance programs, is to have a suggestion box or quote, hotline complaint box for people to email in questions, but then have a system that ensures a prompt response to the person who sent in an inquiry. There is nothing more effective in ruining open lines of communication than not responding when people ask you a question or utilizing the email box that you've created and it's perceived as a black hole. And finally, get feedback on the training, use surveys, and if people don't like filling out the surveys, ask people directly what did they think of the training and how could it be improved, so that you again can create that dialogue. And finally, and this sort of goes without saying as well, is to communicate directly with the board of your organization. As a compliance officer, you should be reporting regularly to the board on the compliance program activities, including the reviews that are being done and the reports that you have received. The heart of any real effective compliance program is a proactive and ongoing internal audit and review function. As part of your goal setting that I talked about, you should create an audit plan for the year. This can include the number of audits that you want to accomplish and what, in fact, you want to audit. If you're having trouble deciding what to audit, think about the risk areas for your organization in these three areas: coding, contracts, and quality of care. Coding and quality of care are probably pretty obvious, and by contracts, I mean your relationships with physicians, referral sources, and compliance with the kickback and start clause that Meredith talked about. Make sure that the people who conduct the audits are qualified. If you have qualified people internally, that's great. If you don't, you should engage outside competent auditors to conduct those audits. A couple of tips on auditing, a little bit more to drill down on that. When you are designing audits, you don't need to audit 100% of the claims in a given area. Use sampling and set parameters to the audit design. There are lots of auditing resources out there as well. Some sampling guidelines are in the OIG self-disclosure protocol. Our corporate integrity agreements also have reviews as part of those agreements, and lots of them are very different from each other, and so those are a source to look at in terms of deciding how to structure a review. If you do audit a sample, a note of caution about sampling, however, if you do audit a sample for a limited time period and you find a problem, you may need to do additional audits and expand that time frame in order to determine when the problem began and to find all of the overpayments or other errors that you may have. Also, if you find a problem, you need to examine what the cause of the problem was and what do you need to do to prevent that problem from recurring in the future. Of course, you need to report and return any overpayments. You also may discover that you have potential fraud liabilities under the Civil Money Penalties Law or the False Claims Act that you may need to disclose to the government. I'll be talking more about self-disclosure in the second section of this program. And finally, you need to have a corrective action plan to end the audit. This can include employee training, employee discipline, additional audits into your audit plan. You may discover that there was an unexpected, you may have an unexpected finding and decide that you need to audit this area in more years or in different ways. You may also need to identify process improvements, changes to your policies and procedures, changes to the way that you deliver the service or that you bill the service, follow the paper from when the medical record is created to when the bill goes out. There are places in that process that may need improvement. Part of your measuring the effectiveness of your program then is measuring whether these corrective action programs have been implemented in a timely way and whether they continue to be implemented or whether they fall off in the future. And finally, the last topic is a robust process to respond to hotline complaints and the other problems that come to your attention in your organization. You need to ensure that you have a prompt and meaningful response to those issues in order to deal with them effectively. One approach that can work well is to have a team of people who are closest to or more familiar with that particular issue or department to participate in the review. There is, of course, a note of caution that potential conflicts or personal relationships can interfere with you obtaining an objective review, but it's helpful to at least think about whether those people should be involved in the review process of a particular hotline complaint or other compliance issue. The most important thing is to make sure that instances of potential non-compliance are investigated promptly and that appropriate corrective action is taken and documented. And that you have a system, that is one of our favorite words in this program, that you have a system to track the resolution of those complaints and the completion of those corrective action plans. So I've spent a couple of minutes throwing out more ideas and tips on having and measuring an effective compliance program. And now I will turn it over to Geetha Kavedi to talk about our exclusion authorities and how to avoid employing an excluded person, which incidentally is something that we continue to see many healthcare providers having issues with. It's one of the largest types of issues that are come through our OIG self-disclosure protocol. And so I'll turn it over to Ms. Kavedi.